So when the pandemic first began in the United States, no one really knew what to expect. We had seen what had happened in Asia. We saw what had happened in Europe, and those weren't good stories. And we were doing our best to make certain that story wasn't replicated, at least in where we are in this part of the country. And so we started a really great process of partnership with the community, with our people that work with us, all of our team members. We knew something bad was coming, but nobody really knew how bad it was going to be and how we would get through it. So our first and most important goal in taking care of the pandemic was to make certain that our patients were well cared for. But in order to do that, we had to also make certain that our team members and our medical staffs were well cared for. And we saw what was happening in other parts of the country, in the world, where people were reducing their staff and laying people off and furloughing people. And we just thought that was a really bad idea. And so we went to the board and the leadership, and they were extremely supportive. And we knew that from a short-term business standpoint, it didn't make sense to keep everybody on board, but we also knew that from a long-term perspective, and particularly in dealing with the health consequences and doing what was right for the community, it made the most sense to keep everyone on board and not to do what other health systems were doing. And so we did. We kept everybody on board, and it really worked. And it's something that people recognized and appreciated. It cost us huge amounts of money from a financial standpoint, and that's why the charity and the donations that people make, they were essential during this period of time. We were able to keep our team members on and make certain that the hospitals were well staffed and that the clinics could see people, and we think it's been the right thing to do, and it's one thing that we could not have done without the support of people like yourself. There's no question about that. The next thing that we had to face with the pandemic was how we were going to deal with all the different expenses and things that were associated with it. So, presuming we could find the personal protective equipment or PPE that was needed, it was going to cost huge amounts of money. I mean, masks that used to be, I tell you truthfully, masks that used to be 50 cents were now $5. And, we use thousands of them each day. Same thing with gowns and gloves. And so millions and millions of dollars in those kinds of expenses. And we could not have done what we did without the support of people like yourself. The donations that people made, the ability to actually purchase the protective equipment for the team members taking care of patients. That was a huge advantage to our team members. And they appreciated that. They knew that. And it was something that we think we did as well or likely better than other health systems on the East Coast, and was because of people like yourself being able to help us with those donations that we were able to get what our team members need. Our team members are very special people, whether they be doctors or nurses or people involved in environmental services or in the lab, pharmacy. It doesn't matter. They're people that really are true heroes. They take care of patients at great risk to themselves, and our goal was to try and minimize that risk by getting them all the equipment they needed. Other things like testing were enormously expensive, and we were able to find a way to do that. We now have the ability to run in-house testing for the virus. Again, huge expense that you all helped us with in terms of making certain that we could provide that quick, immediate results feedback so that both our patients were well cared for and our team members knew what they were dealing with. So people can't thank you enough for that. That was really great. So then we'll go on to the Eastern Shore. Yeah. So one of the really great stories of cooperation in the health system is what happened on the Eastern Shore of Virginia. People remember there were very large outbreaks during the month of May involving the poultry plants. The poultry plants, the great workers that work there are often immigrant workers. They're often people that English is a foreign language for, and there were these massive outbreaks in the poultry plants. And the Eastern Shore Hospital is a great hospital, but it's a relatively isolated hospital. You have to drive 90 miles, an hour and a half in either direction to get to the next hospital. So we were very worried about it being overwhelmed as these cases mounted. And at the worst on the Eastern Shore, the case rate there was worse than New York City at its worst. So we were very worried about that. And we were able to put together a system where we transported patients in a very proactive way, usually by helicopter. So we would transfer 4, 5, 6 patients a day from the Eastern Shore over to the medical center here at Newport News, where the people here did a great job taking care of them. And that allowed the hospital on the Eastern Shore to be able to not be overwhelmed, to take care of the patients as we balanced the demand versus their resources that were available. And that was an extremely resource-intensive event. Wouldn't want to tell you how much it costs to transport a patient by helicopter from the Eastern Shore to here. It's about a 30-minute ride, but it's quite pricey. And the work that you all do and the donations that you all make and the philanthropy that the foundation helps provide allowed us the confidence to be able to spend that money in a preventative way, in a proactive way, and we think it saved a lot of lives on the Eastern Shore, and we think that's we had the confidence to go forward with doing that because of the support of people like yourself and the entire community that rallied around them throughout the region. So we can't thank you enough for that. Good. And then
effects, financial and clinically.
Yeah. So the pandemic had very real effects on the healthcare system. Some of it was actually a positive effect. It allowed people to rally around hospitals and realize the people that worked here were just great people and very dedicated and put their own lives at risk in terms of taking care of patients as they did each and every day. But it also had many negative effects. It had effects on the stress and the toll it took on the frontline caregivers caring for these patients. Very difficult working in PPE and constrained environments, very difficult in terms of the stress it produced. It had a lot of negative effects on the patients themselves and their families because visiting hours had to be restricted. And so all of that was negative. It also had negative effects on the financial situation of all healthcare systems. So in Riverside, for example, so far as a result of the pandemic, we've lost about $120 million in income. Now, the good news is that the government support for that has been very meaningful and has allowed us to make up well over half of that. And so that's been very, very helpful. And we've been able to reduce other expenses that have gone a long way to getting us to where we need to go. We haven't done what other health systems have done, which is to do layoffs or do furloughs. We didn't think that was the right thing to do, but we still faced a significant gap, and the support that you all have helped us with donations and philanthropy, and that the foundation has help lead, have been very meaningful parts of our plan of finance as we get through this pandemic. We're doing better, we think, than most health systems, and in large part because of the support of our team members and the communities around our hospitals that really make a very, very substantial difference, both in terms of the morale of the people, our team members that take care of patients, and in terms of our ability to deal with the effects of hopefully what is a once-in-a-lifetime event from a financial standpoint. So really cannot thank you enough about that. Thank you.
And lastly, efforts that bring us towards the future and out of this.
So people ask, what does the future hold? It's late October now, almost Halloween. This whole thing began around St. Patrick's Day, and the question is, when will it be over, and how do we see ourselves getting from here to the point where life is somewhat more close to normal? We think we've made a lot of advances, both as a health system and as a society and as a profession, as a medicine and healthcare, and understanding how to treat patients with with coronavirus better. There's just a couple of examples of that. When we first started out, and if you were a patient that was admitted with COVID, your chances of dying in the hospital, they were pretty high. They were about 25%. Now they're under 7%, and the younger you are, the better, the more likely you are to do well. But even for older patients, the chances of dying have gone down dramatically. 70 plus percent compared to the spring, and some of that is our better understanding of how to treat patients medically with that. We don't put patients on ventilators as quickly as we did before. We use other kinds of therapy like high flow oxygen. That's been very helpful. New drugs like remdesivir and steroids have really helped, and we have high hopes for the new antibody drugs that are coming out over the course of the next few months. Ultimately, it'll be a vaccine that helps us. And one thing that we did here at Riverside is these vaccines require really very ultra cold storage. These new types of vaccines, they're hopefully going to be very effective and very safe, but they require temperatures like -70 degrees Fahrenheit. I mean, that's even in hospitals, the best freezers we had went down to -30 degrees. So if we were going to if we had the desire to be a place where people could come to get vaccinated, where we could take delivery of these vaccines that hopefully will come in the next month or 6 weeks, we needed to purchase some very ultra cold storage freezers. And we did do that. We did that about 3 or 4 weeks ago, and they've just arrived. Now all of our hospitals have that. That, believe it or not, in this state, in the state of Virginia, there were no health systems that had that ability to store these vaccines. And so now we have it, and a few other health systems have it, and we're able to do that because, in large part, the help that people like yourself give us, the donations that you give to the hospital, the philanthropy that the foundation helps lead, and your response gave us the confidence to just, in a proactive way, purchase those kinds of ultra cold storage freezers, and now we will be able to, once the vaccine is here, be a distribution point for the vaccine, not just in our hospitals for our employees and team members, but also for our clinics, through our clinics for the patients. It'll be something that I think will distinguish Riverside, and it's in large part we're able to do that because of the support of people like yourself. So we are more optimistic about the future than we were in March. We're more confident about our ability to treat patients like this. We know the clinical results we produce are going to be far superior to what we experienced in March, because our understanding and our technology that we can deploy against the virus has grown. And I would say that when we look at Riverside's clinical outcomes versus other health systems, we do somewhat better than other health systems do in terms of complications and mortality and following the evidence-based protocols. And Riverside is a group of talented people. We think of it as being, when you think of a health system, you think of being buildings and physical structures, but it's actually people. It's people that both work for the health system, the very dedicated caregivers and the people that support them, as well as the people that support the health system that don't work for the health system, people like yourself and the communities, people that help support the system in other ways. And so we feel increasingly confident about the future. And as I say, we can't thank you enough for your support. It's been a meaningful part of why we're confident about the future. Thank you.
That was beautiful, Dr.